Regarding orthopedic theater design is important. It consists of 4 zones. Outer zone, that is rest of the hospital. Clean zone, which is the reception to the theater door. Aseptic zone, which is the scrub and the pre-op and op area. And the disposal zone, that is waste area or sluice. Regarding optimal conditions, there are 4 important things to consider: temperature, humidity, light, ventilation. Regarding the temperature, the patients are hypothermic. We have to avoid hypothermia of the patient. For the patient, the best temperature is 24 to 26 degrees centigrade, while for the surgeon it's 19 to 20. A compromise is taken in between, and in between temperature is chosen, while the patients are given bare Hager if needed, because when temperature increases, it has a lot of effects with the and can also reduce cement working time. Regarding the humidity, it should be 40 to 60%. More humidity increase cement working time. More humidity reduce cement working time. Light, it should be no shadow. It should be artificial and adjustable. Good illumination is minimum 40,000 lux. Now we talk about ventilation. Ventilation is quite important. While we talk about the source of infection, there are 4 sources of infections. First is patient, then is surgeon team, then is instruments, and then is airborne. The airborne is the most common cause of getting infections. When we talk, we shed bacteria. When we breathe, we shed bacteria, and the skin also shed bacteria. For that, we have ventilation system which reduce the airborne bacterial count. This can be checked by a microscopic volumetric slit sample and it's measured at CFU per meter cube, colony forming unit per meter cube. For a cleanliness, it should be less than 35 CFU per meter cube of bacteria and less than 1 CFU per meter cube for Clostridia perfringens and Staph aureus in an empty theater. When surgery is going on, the temperature should be less, the CFU should be less than 180 CFU per meter cube during surgery. Regarding how the ventilation system work, it has specialized HEPA filters. HEPA filters are high energy particulate air. 2 types of filter system is used. One is phlegm and second is laminar airflow. The phlegm consists of comprise that positive pressure ventilation is used. High pressure inside and outside is low pressure. The dirty air goes from inside to outside. Problem is any disruption like door opening will disrupt it. Then is laminar airflow. Laminar airflow is when a pocket is created of clean air. This can be horizontal or vertical. Then there is a concept of Haworth airflow phenomena, that is X flow. So this is more efficient and makes air changes requiring less air changes per hour. Entire laminar flow plays entire body of the air is designated space is with uniform velocity and single direction, and most of the times in orthopedic theaters it's at the ceiling and at the theater room, making a trumpet sort of a flow. High infection incidence, how to reduce. 3 phases. Number 1, stop operating, do not harm. Number 2, root cause analysis, that should consist of patient, surgeon, and implant, and institutional change. Regarding the institutional change, it should be pre-op, intra-op, and post-op. Pre-op, I want to optimize patient comorbidities, MRIC screening, and cell saver technique. Intra-op antibiotics, exhaust suit, gloves, mask, operative policy with reduced ingress of patients, and ventilation. In post-op, isolate the cause, wound management, dressing less change daily, and anticoagulation to avoid DVT prevention versus hematoma.